Each year, approximately 6 million Americans receive donated blood. They are transfused with a second chance at life. Still, some people have doubts about receiving a stranger's blood, fearing contamination of infectious diseases like AIDS. What those people may not realize is that donated blood takes a closely scrutinized, carefully monitored journey before making its way to a recipient. Since the modern blood banking industry was developed in the 1940s, Public Health Service has been responsible for regulating the supply of blood and products derived from blood. Under the Public Health Service Act, FDA has the authority to inspect the more than 2,400 registered blood banks in the United States each and every year.
We monitor the way blood donors are qualified. We set standards for how blood is tested. We set requirements for how blood banks perform their ordinary day-to-day practices. We even approve many of the actual units of blood that are released for distribution.
Safe practices begin the moment a potential donor signs up to give blood. Only healthy individuals are allowed to do so. To determine the health of a potential donor, an extensive series of questions designed to reveal medical conditions or behavioral patterns must first be answered.
Any history of having any problems with your kidneys, liver, lung?
Anyone thought to be at high risk of exposure to the AIDS virus or any other infectious disease will be turned away. But just how reliable is this first line of defense?
It's at least 95% effective, depending on what the condition is that we're looking for. But the evidence pertaining to HIV is that it is more than 95% effective for preventing HIV infection.
Once a potential donor completes this process, approximately 1 pint of blood is drawn. It's a sterile procedure. The needle and the entire collection kit are used only once and then thrown away. This makes it impossible to contract disease by giving blood.
Thank you very much.
Next, the donated blood is typed and identified. If platelets are needed, they are separated at this stage. From here, the most critical part of the process begins, weeding out blood that may be contaminated. Currently, 7 screening tests are conducted on each unit of donated blood, including tests for AIDS, syphilis, hepatitis B and C, and something known as HTLV, a virus associated with a rare form of leukemia. Recently, a test to detect a rare form of AIDS known as HIV-2 was developed. So far, it has not been widely used in this country. While these tests vary in sensitivity, among the most sophisticated are those that check for the presence of HIV.
The AIDS tests are among the most accurate of the tests. We believe that their sensitivity is in the 99+% range. The false positivity rate is quite low, in the range of between 1 to 2 per thousand tested. The reproducibility of the tests is very high.
The test with the lowest sensitivity rate is that for hepatitis C. It accurately detects the antibody about 70% of the time. On this day at one Washington, D.C. blood center, a donated unit of blood was found to carry the hepatitis virus. Once discovered, it was identified in the computer system and then disposed of. According to the FDA, violations are discovered at about 10% of all blood banks during a given year. When discrepancies are found, blood banks are required to take corrective measures or face regulatory action by the agency.
The regulatory actions could be simply issuing the blood bank a letter telling them what practices to fix. It could mean notifying them that we intend to revoke their license if they don't correct their practices. Or it could mean an actual immediate suspension of their operations.
But violations do not necessarily mean the public is at risk. In fact, to date, only one case has been documented linking an error at a blood bank to the transfusion of AIDS-tainted blood.
When we find violations in blood banks, it doesn't mean that people are receiving bad blood. We do our inspections in a way where we can find the violations before there's a significant likelihood of infected blood being transfused into patients.
Still, over the years, problems within the blood banking industry have received extensive media attention, creating a public perception that the blood supply is just not safe. In recent months, media attention has focused on FDA regulatory actions taken against a small number of establishments found to be in violation of acceptable operating procedures. Now, major blood associations are redoubling their effort to make sure member blood banks follow rigorous quality control methods. Experts say without all the safety measures that the FDA and the blood industry have taken to protect the blood supply, more than 70,000 cases of infectious disease would result from blood transfusions each year. Instead, at the current time, the chance of contracting AIDS through a blood transfusion is 1 in 153,000. While the blood supply has never been safer, work continues to make it safer still. The FDA constantly updates guidelines for donor screening and is working with government and industry to develop a new generation of tests that are even more sensitive in detecting contaminated blood. In addition, the FDA's inspection procedures are constantly being upgraded.
We are doing inspections more frequently. Inspections are becoming longer in duration, and the training of the inspectors is being improved so that they can understand the current state of the art in terms of the technologies that are being applied in blood centers.
In a medical emergency or major surgery, a transfusion can save your life. When your doctor determines that a transfusion is necessary, the safety procedures that blood banks and the FDA have put in place are helping to assure that the life-saving benefits overwhelmingly outweigh any risks.